Hey guys, welcome to Fun Learning. In this video, we are going to discuss about the muscles of hip, knee and ankle with the help of the mnemonic. With no further delay, let's get started. First, let us discuss about the muscles of the hip. I hope so you all know that there are totally 6 degrees of freedom in it, which is nothing but flexion, extension, abduction, adduction, medial rotation and lateral rotation. First, let us discuss about the flexors of the hip. In order to remember the flexors of the hip, we have to remember the mnemonic TRIPS. In the T stands for tensile fascia lata, R stands for rectus femoris muscle, I stands for iliopsoas muscle, P stands for pectineus and S stands for sartorius muscle. Okay, among that, iliopsoas muscle is considered to be the primary muscle. Now let us discuss about the extensors of the hip. In order to remember the extensors of the hip, we have to remember the mnemonic government hospital. In the G stands for gluteus maximus muscle, gluteus medius muscle and gluteus minimus muscle. Among that, gluteus maximus muscle is considered to be the primary muscle. And H stands for hamstring muscle, which include semitendinosus, semimembranosus and biceps femoris muscle. Now let us discuss about the abductors of the hip. In order to remember the abductors of the hip, we have to remember the mnemonic G past. In the G stands for gluteus minimus and gluteus medius, P stands for piriformis muscle, S stands for sartorius muscle and T stands for tensile fascia lata. Among that, gluteus minimus and gluteus medius is considered to be the primary muscle. Now let us discuss about the adductors of the hip. In order to remember the adductors of the hip, we have to remember the mnemonic gap. In the G stands for gracilis muscle, A stands for adductor magnus, adductor longus and adductor brevis muscle, P stands for pectineus muscle. Now let us discuss about the medial rotators. In order to remember the medial rotators, we have to remember the mnemonic GST. In the G stands for gluteus minimus and gluteus medius, A stands for semimembranosus, S stands for semitendinosus and T stands for tensile fascia lata. Now let us discuss about the lateral rotators of the hip. In order to remember the lateral rotators of the hip, we have to remember the mnemonic people go and go on questioning. Actually, you have to remember the sentence, not a mnemonic. P stands for piriformis muscle. G stands for gemmules, which include both superior and inferior gemmules. Another G stands for gluteus maximus muscle. O stands for obturator, which include both internal and external obturator muscle. And Q stands for quadratus femoris muscle. So P, G, G, O, Q. Okay, now let us discuss about the muscles of the knee. Now let us discuss about the muscles of the knee. Flexors. So I hope so you know that the primary muscle is nothing but the hamstring muscle. The secondary muscles. In order to remember the secondary muscle, just try to remember this. Gaspograsser. Gas stands for gastrocnemius muscle. Po stands for popliteus muscle. Gra stands for gracilis muscle. And Ser stands for sartorius muscle. So the flexors of knee is nothing but the primary muscle is hamstring muscle. The secondary muscle is gaspograsser. Gastrocnemius, popliteus, gracilis and sartorius muscle. Extensors of knee, which is nothing but quadriceps muscle. There are 4 muscles under this, which is nothing but rectus femoris, vastus medialis, vastus lateralis and vastus intermedius. Lateral rotation and medial rotation, which locks and unlocks the knee, right? So lateral rotation, biceps femoris muscle. In order to remember that, just try to remember BF, which is nothing but best friend. Here it includes biceps femoris muscle. And medial rotation, in order to remember the medial rotators, you have to remember the mnemonic GPS. In the G stands for gracilis, P stands for popliteus, and S stands for sartorius, semimembranosus and semitendinosus muscle. Okay. Now let us discuss about the muscles of the ankle, which is nothing but plantar flexors and dorsiflexors in betas and evitas. First, let us discuss about the plantar flexors. So, in order to remember the plantar flexors, very easy. These 3 muscles are the primary muscle, which is nothing but gastrocnemius muscle, which has 2 head, namely medial head and lateral head, soleus muscle and plantaris muscle. In addition to that, you have to remember this, which is nothing but Tom, Dick, Yates. In that, T stands for tibialis posterior muscle. D stands for digitorum. Okay, here it stands for flexor digitorum longus. And H stands for hallucis. Here it stands for flexor hallucis longus. Okay, so plantar flexors, the primary muscles are this one, and in order to remember the secondary muscle, you have to remember the sentence Tom, Dick, Eggs. Dorsiflexors, in order to remember the dorsiflexors, you have to remember the same thing, Tom, Eggs, Dick, and here try to remember, here Tom stands for tibialis posterior, tibialis, here P, so here also P, tibialis posterior muscle. Okay, so dorsiflexors, Tom, H, Dick. Here T stands for tibialis anterior, H stands for extensor hallucis longus, and D stands for extensor digitorum longus. If you remember this, you can easily remember this. Okay, the exact opposite to this one is nothing but the dorsiflexors. So, in order to remember the inversion, you have to remember the mnemonic tap. In the T stands for tibialis, A stands for anterior, and P stands for posterior. That is, tibialis anterior and posterior muscle are involved in inversion. In order to remember the eversion is nothing but where your feet move laterally, right, like this. So, the lateral muscles are going to helpful in performing eversion, which is nothing but peroneus longus, peroneus brevis, and peroneus tertius muscle. With this, I am completing today's video. Thanks for watching. If you like this video, please subscribe to my channel. Stay home, stay safe.